Um, my name is Kasey Potts. I am a content creator and host of the podcast Millennial Mom, as well as a regular contributor on KTLA's morning show. And I am thrilled to do our next panel. I have two amazing women. I'll bring them up here. We're going to talk about biohacking and longevity. Would anyone else like to biohack their body? Yeah, all right, why not? Let's do it. Let's bring up Dr. Jaclyn Tolentino and Sarah Glicken. Come on up, ladies. So let's do a quick intro. Dr. Jaclyn, why don't you start?
Hi, I'm Dr. Jaclyn. I'm one of the lead physicians at Love Life. Really excited to be here. It's probably about 30 to 40 minutes away. I represent Love Life. So Love Life is in El Segundo, California. We also offer precision wellness, nourishing food, recovery modalities, all in one place, including a team of experts of more than 12 of us that practice functional and integrative medicine. So nice to see you all.
Which I looked at your website, and Love Life looks like a spa or like a resort. It is beautiful. So we're going to talk about it in a second, but Sarah, go ahead and introduce yourself.
Yeah. Hi, everyone. My name is Sarah Glicken, and I really work in the space of physical longevity, which is quite a niche area, but my primary focus is on bone health. So I own multiple locations of a franchise called OsteoStrong, which is a technology that increases bone density. And I also have a bone imaging company that uses an ultrasound bone density scanner out of Italy, which is 5 times more accurate than DEXA scans. It looks at bone quality as well as bone quantity. We're over in the beauty and the wellness lounge. We have our scanner here today. We're doing them.
I did it. I did it earlier, and my bones are pretty strong. I was
know.
That's one thing that's strong. It's good. Okay, Sarah, why don't you tell us, we keep hearing these terms, longevity, biohacking. What exactly does it mean?
That's a really good question. So, of course, I mean, longevity is a really big buzzword right now in the wellness space. And another buzzword that I will use, but I think that is really relevant, is that we're talking about health span and not just lifespan, right? So when we're talking about longevity, we obviously all want to live for a long time, but what is really important is the quality of the life that we're living while we're here. So I would arguably rather live really well and healthy and without pain in my body, et cetera, while I am here. So I think that is a really big part of the conversation around longevity, is like, how can we live well while we're here? And we can talk a little bit more about all those buckets of how we set that up.
I love that. Jaclyn, what are some of the findings or the latest findings you're seeing in longevity?
Ooh. So I work in a space where our patients have access to some of the latest and most cutting edge advances in technology when it comes to longevity. So think about the cryo, think about cold plunge of different gradients, think about infrared saunas and dry saunas. And also, from a physical perspective, we also have fitness trainers that perform musculoskeletal assessments, a longevity screen, so lots of different things. But the secret is, the foundation remains the same, and it's always going to be the same. Focusing on how we eat and how we nourish our bodies, focusing on our circadian rhythm and how well we sleep, focusing on stress, focusing on building community. So even though we have access to these incredible tools and advancements that you hear about in the world of longevity and biohacking, at the end of the day, we still have to take a step back and focus on the foundation. That'll always be tried and true, and then we layer on top of that.
You just brought up something that a friend of mine mentioned. It's mastering their circadian rhythm. Oh. Is anyone familiar with how to master your circadian rhythm? Because this blew my mind. Jaclyn, can you give us like a couple tips of ways that, one, how we do it, and two, how it's beneficial?
Yeah, so circadian rhythms. The best thing that I always remind myself is we should be outside during the day and really soaking in that natural light. And then at night, we should be in an environment that is also toned down to relax your body and prepare for sleep. And our bodies are actually entrained to the circadian rhythm, meaning that when it's light outside and when the sun is up, we produce certain kinds of hormones that our body is meant to. And of course, when the sun is down, we also produce certain kinds of hormones to help support that so that you can sleep and restore for the next day. Best thing that I like to do, always get outside first thing in the morning, because when you wake up and you go outside, you are then training your body and training your circadian rhythm to align with the sun, with the rising of the sun, and that helps to support something called your cortisol awakening response. It's the stress response in your body that helps your energy and helps you get going throughout the day. It's very different than at night when we want to focus on rest and darkness, and ideally we want to avoid heavy meals and avoid eating too late because our body wants to rest, not digest all of this food. And so those are just a few little tips that I think of for circadian rhythm.
I love that. Yeah, my friend was telling me that she goes outside and looks into the sun without sunglasses on or anything to absorb as much of that as possible. It's so fascinating. Sarah, do you have any tips for that too?
I do, because it's interesting, exactly what Jaclyn was talking about all of these different pillars. I mean, if you go over and look, I have a document at our booth called The Pillars of Bone Health, and it's exactly the same pillars, right? I kind of like to think of it as the top of the funnel, which is sleep and stress. And then we go from there looking at nutrition, supplementation, exercise and stimulus, hormone health. But in regards to sleep, I mean, I think that sleep hygiene, it's something I take incredibly, incredibly seriously, because it's where we rebuild everything. And if we are not getting high quality deep sleep and REM, we can't even do the rest of the things that our body wants to do, because our bodies can't rebuild. So, I mean, I walk the walk. All of my lights turn red at night in my house. I don't have any.
There's an
blue
iPhone
light.
setting now that turns your phone red. Do you guys know
Yeah.
about this too? So you're not getting all that blue light.
Yeah,
That's
the
really cool.
Hue lights can turn different colors. So all of my lights are red and amber. I have an 8-sleep mattress, which cools my mattress down to a temperature that makes it better to sleep. I tape my mouth shut at night so that I only breathe through my nose. I do. Yeah, I saw your post on sleep as well. It's a really, really important thing. It's like one of the main things that we can start to focus on.
And I love that
really
you called it
support that.
sleep hygiene too. That's so, I haven't heard that terminology before. I like that, sleep hygiene, keeping it clean. Sarah, let's talk about physical longevity though. How does our physical health and even our bone health really lend to that longevity?
Well, if we think about our bones as it's really the foundation of our entire body, right? So if we think about a car, like I always like to equate it to a car or to a building, if we put a Porsche motor inside of a Honda Civic chassis, it's not going to run very well, right? So we really want to be thinking about how can we start building the foundation of our bodies so that everything else runs? Because if we don't have our physical longevity, we don't really have anything else. And that is where we start with thinking about our bones. And it's my belief that we could really be starting to think about it at a much younger age, because as a country of sick care as opposed to health care, we don't even start looking at bone health until we're 65, right? That's the age that most people get their first bone density scan. I believe that we should start testing in our 30s so that we can start seeing if we're even on a trajectory that our bone density is starting to go down, because it's much easier to prevent things from happening than it is to have to cure something once it's already there.
Yeah.
So I'm going to tell you something interesting. At Love Life, we see patients, anywhere between 18 and up, and we do bone density testing on the younger population. So we don't wait until people are 65 in order to get this test done. And what we're already finding is that so many women and even men in their 30s and 40s are already struggling with problems like osteopenia, where their bones are already starting to show signs of being brittle. And that's alarming, because most people aren't testing this until they're 65. And so luckily, as our patients are coming through, we do that scan, because I think it's so valuable. And instead of waiting, why wait when there's so many things that we can do now in our 30s and our 40s and our 50s? So.
Exactly. I said this in an earlier panel that there's this arbitrary number of women should start caring about their health at 40, right? 40 is when we get our mammograms. 40 is when we should start looking at, all these different health markers. But I know I had to advocate for myself to get a mammogram prior to 40 because of family history and everything. What are some of the ways that you're seeing your clients kind of advocate for themselves and what they're doing with this empowerment that you're providing for them with the resources you give them?
Well, I'll give an answer as a non-physician, and then I'm really excited to hear how Jaclyn responds to this, which I'm pretty sure I know. But, I think that one of the biggest things is that we need to be our own strongest advocates. And Kasey, you and I were talking about that earlier. So if a physician is telling you something that you do not feel is right for you, then it may be time to hire a new physician, because the truth is that they are working for you. You are not working for them. And so it's really important that we need to build a rapport and have a relationship with them. And if we don't feel like we're being served in the way that we should be, then we should be looking somewhere else.
Well, we talked about that. I always tell people, date your doctor, right? Date them, and if it's not working out, if they're not listening to you, move on, find another one, have your friend set you up. Just date your doctors to find the right one.
In women's health, I mean, it's pretty shocking the amount of OBGYNs that are actually trained in all of women's health as we age. I heard a statistic that I don't have the data to back it up because I haven't seen the studies, but I heard a statistic that less than 5% of OBGYNs are actually trained in menopause medicine, which is complete insanity when the entire population of women are going to get older. So they're trained from fertility up through, from periods up through fertility, and then it's like a forgotten
Gets cut off.
Group.
I mean, our patients at Love Life, I think the best thing is that not only are they able to advocate, but it's much more than that. It's really a collaboration. People are spending a lot of time with us, so over the course of the years, there's multiple hours that they're spending. It's not just the 15-minute visits. They also have access to multiple experts, including a registered dietitian, the health coach, Eastern medicine practitioners, who all work together. So the fabric and the philosophy of the care is really this tie between Eastern and Western medicine in a beautiful sanctuary where they have access to functional fitness and recovery modalities and nourishing food. I think where the hard part is people do need to test. We do need to show up. We do need to advocate for ourselves. And sometimes even coming to terms with the kinds of symptoms that you're experiencing and wanting to do something about it, that's hard. And not everybody is ready to do that. So being able to come to terms with that and take inventory for what's going on in your life and what your symptoms are, and staying curious about it. I think so many people are shut down by doctors all the time, and they always feel dismissed and overwhelmed, and they go home as though none of their symptoms were taken care of, and they still have so many questions. Yeah. And so I think that's where we start. We start with having collaborative conversations, owning it on both sides, where doctors are also listening to their patients, and it's not just a 10-minute conversation.
Absolutely.
And one other thing about that I think is so valuable is using all of the information that we gain as knowledge is power. So we tend to be in a society where things are very fear-based, and so we get very scared when we find out results to things, and then we deflect and we don't want to deal with them, and so we look another direction as opposed to saying, I'm so glad that I got this information because now I have the information that I need, that I can start collaboratively working with my team to actually do something meaningful about it and not look the other way and have it be something that becomes this conversation.
And I think that's an interesting point too. You said with your team, right? It's not just your primary care doctor. It's not just that person you see once a year. You have to truly create your team. And Jaclyn, that's really what you guys are doing at Love Life. And tell us a little bit about how you're approaching things holistically and what that holistic snapshot looks like.
Yeah, so I used to work at a place where we took primary care to another level. We had access to doctors and health coaches, and together they were marrying this journey for people. And now we've taken that even further. So we've elevated that. So people have this collaboration, not just with their doctor, but multiple experts on board. So imagine every week having your doctor, your registered dietitian, your personal trainer, your physical therapist, your Eastern medicine practitioner sitting at a conference table talking about your health.
You feel like Jennifer Aniston. Right? I think that's how I would feel if that's the team I had. Wow.
And so that's what we're creating. We're creating a different kind of environment where we still have the foundations, and if I still needed to prescribe medications, I absolutely could. But within an ecosystem like what we have, it's not the only tool in the toolbox anymore. You have access to so many other philosophies that are marrying together. We have access to natural treatments. And so trying to find that collaborative team, I would encourage everybody to do that.
I love that. How are you doing in your practice as far as collaborations, working with, I mean, say someone's getting their bone scan, how are you then working with their designated team or helping them find that team?
So we are really educators, right? So we're not practitioners. We don't treat, diagnose, or cure. We leave that to doctors. So what we do is we try to guide people towards the areas and the resources where they can do the things that can support them. So we have resource guides where we will guide them to, if you're told that you are not a great candidate for hormone replacement therapy and yet you have all of the symptoms which would lead you to potentially needing it, we have options of physicians that we would guide you to that will have that conversation with you. So we try to act as like a guide and in helping to sort of create that. And it doesn't all have to be, I mean, I know it can sometimes be very expensive, and the goal is not that this is only for the 1%. Because there's a lot of resources out there that are less expensive resources, and a lot of online resources, even if you can't afford to have a cash-based practitioner. And there are some really great, I mean, I have an amazing doctor who's at Providence, and he's really into biohacking and functional medicine, but he's in network, so
That's
he'll
very
do any
rare.
of the lab tests that I want, and that's a great.
That's wonderful. Sarah, talk a little bit more about, let's go into OsteoStrong and the precision bone imaging, just really what you are finding in women. I mean, take a look at our median age, right? Like, what should we be looking at? I know you just did my scan, and it was interesting to see how what was it, my femur versus my spine, there was even discrepancies in those, and just one bone is not the same throughout your whole body. What are you guys kind of finding, and what should we be on the lookout for?
Yeah, that's so we reach peak bone mass when we're 30, right? So we gain most of the bone density that we're ever going to have by the time we're like 18 to 20. And then our peak bone mass is at 30. So after 30, we start losing bone density. And that's only when we're talking about the natural progression. That does not include if someone has had an eating disorder, if someone has been on medications like they have a thyroid issue and they're taking Synthroid, if they've had to be on steroids. There are a lot of different other things that are, if you've had cancer and there are certain drugs that you take, that a lot of those are what we would call bone robbing medications. So we start to think about, if we're reaching peak bone mass at 30 and then it starts going down, when can we start looking into our bone health? And I think, I mean, our belief is that, especially now that we can do it radiation free without needing to get a prescription and not doing it through a DEXA scan, if we can actually do it, an ultrasound bone density scan that anyone can do, like, why not start doing it when you're 30? Because what we're seeing is, even if we're doing all the right things, the reality in our culture today is that our foods are deplete in nutrition, right? There's been a lot of research. UCLA did a study where they showed the same amount of spinach from like 1950 to today, and you'd need something like 20 cups of spinach to get the same amount of nutrition that was in a 1 cup of spinach then. So nutrient density, we're eating way more processed foods. We have a sedentary lifestyle. Even if we're going to the gym, the rest of the time we're primarily sitting in front of screens. Our stress levels are so much higher. Environmental toxins are so much, so there's a lot that's working against us, right?
Yeah.
So my suggestion is that we start thinking about it earlier, because the truth is, we've done almost 2,000 scans since July of last year, and I can count on one hand the amount of people, she being one of them, that had totally normal bone density.
I'm not a milk. I never drank milk either, so it's not a milk thing.
I have a question for you. Treatments. Oftentimes patients will come to see us and they'll say, my doctor doesn't want me to be on hormone replacement therapy for bone health. Can you speak to that? Do a lot of the people that come to see you at OsteoStrong, are they really struggling with finding a practitioner who is willing to prescribe them certain medications?
Yes. So I am a huge proponent of bioidentical hormone replacement therapy. I mean, I'm really the poster child of this. So, I mean, I'm an open book. I just turned 54. I had to have my ovaries removed last year. And when that happened, I lost all of my endogenous hormones completely. And I went from really great bone density 2 years ago to osteopenia 2 years later. And in 6 months, I've increased my bone density in my spine by 4%. And I imagine that within a year, I'll have an increase in my hip as well as my spine. And that's through a combination of very intentional hormone replacement therapy with a practitioner that is getting me into the optimal range, not the normal range. It's doing OsteoStrong weekly. It's taking specific supplements, minerals that can all support it. But I think very often we see people who are really frustrated because the most physicians, they're trained to diagnose and they're trained to prescribe and then they're trained to cut, right? I mean, if you were to break it down into the most simplistic terms of allopathic Western medicine. And, you know, there's a time and a place for medication, but bisphosphonate drugs, for the most part, in my belief, they really create kind of a candy coating around the outside of the bone, and they're not looking at the root cause of why is my bone density going down in the first place, right? Why aren't we looking at that? And that's the kind of thing that your practitioners can be looking at. And estrogen is so key for it. And if we do not have proper estrogen levels, it's almost impossible to have good bone density.
All right, well, as we wrap up, I want to ask both of you for your top 3 tips or hacks, biohacking hacks, that we can all kind of walk out of this room with and keep in the back of our mind.
Ooh, I mean, we would be here all night if
Just
we
three,
had more
just
time.
3.
Top 3. I would say get outside as much as possible. As somebody who works indoors frequently, I think that we're not outside enough. I think 90% of us are indoors. That's the latest statistic that you hear. And so that is an important one, especially if we want that natural vitamin D. The next thing is that morning light. It does something a bit differently than that middle of the day sunlight experience can get you after your lunchtime walk. So making sure that you get outside in the morning to reset your circadian rhythm. And when it comes to seeing your doctors, advocate, stay curious. And I absolutely agree that if it's not a collaborative experience and you're leaving feeling frustrated, overwhelmed, and disappointed, it's time for you to find a new one.
Well, I would say ditto to everything that Jaclyn said, but I'll add in a few of my own. And I recognize that the things that I do are probably, you know, more than most people do. But I will also say that I just got my biologic age, and it's 18 years younger than my actual age. So I'm for sure walking the walk. Nice. 2 of my biggest absolute hacks that I do almost daily are infrared sauna and cold plunge. I have a cold plunge at my house. I did it at 6:30 this morning when it was really cold because I wanted to be focused and aligned and in my body and present to be here with all of you today. And, you know, when you can get into 45-degree water, you can, I mean, everything else it seems easy, right?
LA traffic is nothing.
So those are 2 of like my biggest ones. And then another one in terms of, I've got a lot of devices and there are different ones that do different things, but like one of my favorites right now, actually.
What is she going to pull
out?
I'm
not an affiliate or anything, I just love it. This is the Apollo Neuro, and this is subtle vibration therapy. And so it acts similar like the way that tapping would act. So right now I have it on a setting called Focus, which just helps with calm and you get a little nervous when you're getting up on stage. So this is one of my favorite devices. I use it to sleep at night. I use it when I need some extra energy in the afternoon. I think it's a brilliant device. It doesn't work the same for all people, but I love it.
I can hear people saying, what did she say it's called? Say what it is again.
The Apollo Neuro.
All right. Okay, well, that is all the time we have for now. Ladies, if you don't mind, maybe will you hang out over there if people have questions for you? All right. Absolutely. Thank you guys so much.